Hi, my name is Anna. I'm a student physical therapist. Is it okay for you to be in this video and for it to be viewed by my teacher and fellow classmates?
Yes.
Okay, so I know that you're 12 weeks pregnant right now, so that is why we have you in a semi-reclined position for the health of you and your baby. But also this helps with helping to relax the pelvic floor and our abdomen when we're doing the activities that we're trying to do, because we want to relax that pelvic floor before we get started on activating it, because we can't activate an already tight pelvic floor, which is the issue that you're seeming to have right now. We also have your knees propped up for that reason as well, for comfort and relaxation. Okay, so now I want to explain what the pelvic floor is. So the pelvic floor, so we can envision our body, our abdomen, and so as like a cylinder. So the front of that cylinder would be your abs. The back muscles are the back of that cylinder. The top of the cylinder is your diaphragm, which helps you to breathe. And then the bottom of that cylinder is the pelvic floor. It's kind of like a hammock that holds all your organs in place. And also it's a pressurized system. Okay, so if you have any questions about that, feel free to ask. And so what we're going to go ahead and get started with is that relaxation part of relaxing that pelvic floor. We're going to do some stuff that's called diaphragmatic breathing. So I want you to imagine that there's a balloon, like this is the tie of the balloon, and this is the big part of the balloon. And as you're breathing in, you're expanding that balloon, and you're allowing your pelvic floor to relax and expand as you breathe in. And that's the balloon expanding. And then when you breathe out, I don't want it to be a forceful exhale. I want you to relax and let the exhale come out of you.
Okay.
So one hand's going to go on your chest, and one hand is going to go on your abdomen. And I want you to feel that rise here, and I don't want you to feel it here as much as possible.
Okay.
And again, feel that balloon rising. And breathe in through your nose, and then out through your mouth a little bit longer. Great, how'd that feel?
Feels good.
Good. All right, so we'll do 2 more of those to get really relaxed and just try and really just let it all go. Okay, we'll say we've done the 3 of those, so that now my patient feels nice and relaxed. And then now we're going to move on to activating your pelvic floor. So I'm going to have you in side lying for this one, and I'm going to have you turn away from me. And you can use this pillow for your head. And we can put a pillow here. There we go. And so do you mind if I feel your stomach area as well as your glute area, your buttocks region, to make sure we're not activating those muscles while we're doing this activity?
Sure.
Okay, so let me explain. When we're doing this, I want you to now engage your pelvic floor. I want you to almost act as if you're trying to stop yourself from urinating, where you draw in that pelvic floor, and you should feel it kind of lift lightly. Not enough to contract your abdomen, and not enough to contract your glute muscles in your buttocks region, okay? So that's why I'm going to feel for those to confirm. So go ahead, and whenever you're ready, go ahead and draw that pelvic floor in. And then you can relax. How did that feel for you?
Good.
Okay, so now that we've done that one time, I want you to do that again, but we're going to hold it for 5 seconds.
Okay.
3, 4, 5, and relax. And keeping on that breathing, you're doing a great job with your breathing. Let's just keep continuing to breathe properly while we're doing this. When you do a contraction of your pelvic floor, you always want to be breathing. We'll do that again and hold for 5 seconds. 1, 2, 3, 4, 5. Okay, and we'll just say that we've done that whole round of them. I would want to perform, we would want to hold that for 5 seconds, and I want to do 3 sets of those, and you can do this throughout the day, but first I want you to get nice and relaxed before you do those.
Okay.